Well, I'm back with another video to follow up on my most recent post about enrolling in Medicare, or is it necessary? Well, I got some news for you. If you are 65 years old and are on Social Security, then you may pay less for Medicare than for the insurance or the health insurance that you are getting through your employer. So don't be afraid to switch over. Now, here's the thing. Everyone's situation is different when it comes to Medicare and your health care situation. It depends on, how much income you have, how much you make, and the employer situation that you're in. So it's very important, and put a pin in this, it's very important to talk to a licensed agent, or you can call the 800 number for ssa.gov. You can go online and look and read for yourself, ssa.gov slash Medicare. Here's what I discovered is the average American is paying over $1,000 a month for medical health insurance. Now, that could be one person or two people in a household. Did you hear what I said? The average American that's over 65 is paying more than $1,000 for the household monthly health insurance. Now, according to Medicare, and currently Medicare is $185 a month for Part B. You get Part A free, and you're paying $185 a month, and some individuals pay for Part D prescription, which could be $5. And they're paying sometimes, in many cases, zero deductible for the provider that they choose. So it's very important that you get some professional help to help you decide which route you want to take. It's probably easier than you think it is. It may seem a little intimidating, but Susie, it's not that complicated. You just have to make a decision to do it, to try it. Now, this is the year 2025 where anyone who has turned 65 years old, that you were automatically enrolled in Part A and Part B of Medicare. Now, with that said, Part B is a portion. However, you can drop Part B if you want to do that as well. Here's the thing. You can drop that and you can switch over to what other insurance that you want to be a part of. Understand this. Medicare is subsidized by the government. So you paid taxes. We've already paid into this governmental system of Medicare, whether we like it or not. If you are receiving Social Security, or you worked and paid taxes, you were paying into the system that actually belongs to you. But because the government is so large, it works with these providers to bring the cost down for us. And in some cases, you will get more for your money than your current health insurance. Signing up to Medicare could mean eye, so you get vision and dental care as well. So it's very necessary to read upon this, to look at this, and figure out what you need the most. So your need is going to be different than my need. You might need vision more, or you might need dental more, but not basing everything solely on those needs, just your routine health care, your wellness. Those are the primary things that you want to deal with. And your health is everything. It's very important. It's very important that we get to our doctors as seniors to help us to navigate these latter years of our lives because our bodies have changed. Our digestive system has changed. Our eyesight has changed. And so we can do better. We can get the support we need, and it is free. You do not have to pay someone, you do not have to pay a broker. No, just go online or call that 800 number. I cannot stress this enough. The open season is right now. It goes through December the 7th. It is time to make that change. You could be one of those who will be paying 185, or Medicare is going up. It's going to be I think $206. So it's going up about $21. So $206 a month compared to $1,000 is almost nothing. In some cases, to people, that 200 is still a lot of money, but I'll tell you, it is way less than something that's $1,000. That's $800 back in your pocket. Do you feel me? $800 in your pocket. Think of all the things you could be doing with $800, like saving and spending and going on a trip. You can go out of town, you can eat out, you can buy some more things, buy some more clothes, enjoy yourself, get a massage, do things like that. My friend, you got this. You got this. We need to do this. The government is waiting on you to sign up because they've already taken our monies, anyways. So why not join that crowd? It is government subsidized. Look at it, read it, and they probably sent you some literature in the mail. So check your past mail. If you're one who keeps mail, you might have some documentation in the mail that you tossed or did not toss. I was looking, in fact, Medicare sent me a card through the mail, and I didn't even realize it until we're down the road now, and they had taken money from my automatically deducted money for Part B, and then I found the paperwork that they had sent me that told me about the automatic deduction. Read the mail that comes through. Read the mail that comes to your house that has government on it or SSA on it. Read it. You might find some valuable information there. And again, I say, don't be afraid to call, reach out. Don't be intimidated. Write your questions down because we do forget as seniors. Write your questions down and be prepared to get some answers to the questions that you have. And you might be saving about $800 a month. How does that sound? So thanks for watching, and check me out in my other videos that help seniors with health, happiness, and prosperity.